You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. I'm super excited to have today's guest on. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. Very excited to introduce a colleague of mine, Dr. Shawn McPeck. A 2010 graduate of Colorado State College of Veterinary Medicine and Biomedical Sciences, Dr. Shawn McPeck developed his leadership as a sniper team leader and veterinarian with the U.S. Army Special Operations 75th Ranger Regiment. Dr. McPeck has multiple combat deployments, total amount 2 years in combat theaters of operation. He is the recipient of the Combat Action Badge and is Ranger, Sniper, and Airborne qualified. Dr. McPeck authored the RCAP Range Canine Athletic Program, which was the first comprehensive military canine conditioning program. His specific training and certification classes for dog handlers to be proficient in canine tactical combat casualty care and knowledge of current medical equipment and procedures, which led to his success life-saving interventions by handlers in real-world operations. Shawn, welcome to the show. Thank you for finding the time.
Hey, thank you for the introduction. I appreciate it. Thanks for having me.
That's a hell of a history. We need to unpack that a little bit. Were you in military post vet school, or how did you combine the two in your mind, and how did you get where you are?
Yeah, so actually, it's a very abnormal military career. So right out of high school, I enlisted into the military and really wanted to be going to the special operations. Was in the 75th Ranger Regiment and 3rd Ranger Battalion as an enlisted infantryman. And that's where I went up through the ranks from private to sergeant and became a sniper team leader, went through Ranger School, and ended up leaving after about a 4-year tour. Left active duty. This was pre-Global War on Terror, pre-9/11, so wanted to go to school. Stayed in the National Guard while I was going through undergraduate and got accepted to veterinary school. Stayed in, was actually doing ROTC, so I became commissioned as an infantry officer. In Colorado, unfortunately, they didn't have a place for an infantry officer, so luckily they had a Special Forces National Guard unit. It was 19th Group. Stayed with them as an operations officer, and then went back to active duty after graduating from veterinary school, and immediately was deployed as a veterinarian to Afghanistan for a year and was down in Camp Dwyer, the Helmand province, taking care of all the Marines dogs. So the Marines at the time, they had a program called the IDD program, the Improvised Explosive Detector Dog Program. They were all Labradors, and they were not allowed to go outside the wire on patrol without these detector dogs. And so obviously being as effective as they were at finding improvised explosive devices, they were starting to be targeted, and so the need for veterinary care was there. But the primary thing that I saw was a need for was training those handlers, training them to be the first responder, because veterinary care was far and few between and the whole footprint that we were operating in. And so it was really important that those handlers, that those medics that were with the groups, those naval corpsmen, that they had some understanding of basic intervention when it came to life-saving things that we can do. And at the time, TCCC, which is Tactical Combat Casualty Care, that is what the medics practice for human medicine. We can apply those exact same things to the canine. Those military working dogs need the exact same things if they are hurt or injured as a person does. And we use what's called the MARCH algorithm, which is the things that you can do to stop things that could kill that canine. Obviously, the big one being M for massive hemorrhage. We can stop a bleeder. The next one is looking at the airway using MARCH, M-A-R-C-H. Massive hemorrhage, airway, respiration, circulation, and then H3, so head trauma, hyperthermia or hypothermia, and teaching those handlers and those medics how to intervene in the need if that dog is injured. So that was my initial time. After leaving my first tour of Afghanistan, I realized I wanted to get back to the special operations community. Went back through Ranger selection again 13 years later, and was now as a the Ranger Regiment veterinary surgeon for the 75th Ranger Regiment. So full circle, where I started out, and then 13 years later going back through Ranger selection as now a commissioned officer and a veterinarian. So a very abnormal veterinary career, did 19 years and then got out in 2016 and decided to make a run at starting my own hospital.
It's incredible. I do want to dig into the hospital and the story now, but just from your time there, and I don't know how much stuff you can share or not, but have you had the casualties of the pets that were in, I assume they were searching for explosives. They were targets probably for the opposing side. And have you had anything that you had to deal with clinically with the situations?
Oh, for sure. Yeah. Nonstop. They were, besides something like having an MRAP, which is a up armored vehicle, and those dogs would get in the vehicles and they'd be laying down on the floor. And so if they ended up hitting some type of an explosive device, the soldiers that were sitting on the sides, they're sitting upright, they've got this padding, they've got this buffering system underneath them, but the dogs sitting on the floor, they absorb all of that impact. And so having a lot of post-explosive exposure, the dogs were being targeted by snipers from the enemy combatants, and so had a lot. And then silly stuff, dogs breaking teeth in theaters of operation, having to do root canals in downrange in Afghanistan, of course. But yeah, had a lot of injuries with the dogs. Everything from just getting wrapped up in concertina wire while they're out in deployment to getting targeted and shot, and blast trauma and everything in between. So, but a lot of my deployments were actually with the Ranger Regiment once I became a veterinarian for the Ranger Regiment, and rotated downrange another 3 times. So had 4 total deployments. One was a year, and then each subsequent one was a couple of months, usually about 3 months.
That's awesome. Shawn, we have all kinds of interesting conversations with innovators across the wide spectrum of veterinary medicine. And I believe out of 180 some interviews that we've done, you're the first veterinarian that we've had on that's been in active military service. And so it's interesting because we have tons of conversations about leadership and about innovation. And this is really, when we saw the topic come in, we were super fascinated and kind of couldn't wait to have you on the show, because I'm sure, transitioning from military service to vet school, back to military service, now being a civilian and running a large vet hospital in Alaska, you've probably picked up a few things along the way. And so I'd like to dig into the topic of leadership and, what you've learned kind of along your career path that you've taken into running your successful vet hospital today, and maybe just some lessons that our listeners could apply to their own veterinary practices.
So, yeah, definitely there's a lot of things that I learned being in the military, both enlisted and being a non-commissioned officer in charge of individuals underneath me, very young at the time, to then later on being a commissioned officer and being in charge of individuals in the military, and the leadership lessons learned, being able to take those and apply that to the civilian sector. Sure, there's a lot of things that can cross-correlate, but there's a little bit of difference in someone that is in the military and giving them direction versus individuals in the civilian side, and how you approach that, whether it's counseling, corrective counseling, whether it's dealing with the culture and trying to improve morale, those type of things. So yeah, I realized that in the civilian side, dealing with your culture is really important to the success of your hospital, and being hyper-focused on weeding out the bad apples and rewarding and focusing on the good ones, right? Attitudes are contagious, and it doesn't matter if it's a positive attitude. If you come in with a positive attitude, that influences everyone around you. And the inverse is also true. That negative attitude coming in to the workday, and if you're carrying the burdens of your life, the stresses, and having that reflect while that's going to spread. And it doesn't matter if it's top down or bottom up. You've got those technicians that come in and they are toxic. That spreads, and that leads to a toxic work environment that leads to individuals not wanting to be a part of the team. And so you've got to be hyper-focused on corrective counseling or having people leave the team that are not adding to it. So that's where I realized that the biggest impact that I could make is being focused on the lessons learned on counseling and conflict resolution and dealing with a team environment and hyper-focused on building that team camaraderie.
So that's awesome on the aspect of culture. What about the processes? Because I know, and in fact, actually, Shawn, we did have a couple of guests that were in the military before. So Erica, she was through military after the vet school. And then when she got into the real world of veterinary medicine, I remember her feedback, and I don't know if that's your observation, the lack of systemization in our domain and the lack of processes and the way it's so dialed in the military. Do you observe that, or were you able to incorporate some of that process driven sort of regimented management aside from the culture, but also that aspect? Did you see the difference? Did you see the opportunity, and did you apply any of your learnings from there into your current practice?
Sure, there's correlations. I think the biggest thing that I was in a very unique environment, because being in special operations, everybody that's around you wants to be there. They went through a selection process. They are devoted and they are very motivated individuals. And so you look left and right and you know that each one of those went through the exact same hardships that you did, and they want to be there. So on the veterinary side, individuals, there's a high turnover rate, especially with the veterinary technicians. You look at it's not viewed as a career option many times. It's viewed as something temporary. Well, I'm going to do this while I'm going through school. And so how do we improve that mentality of options for people to have a career there, but showing them that there's a ladder and them wanting to be there? And so that's what I worked really hard to do, is try to create something where there was a ladder that they could progress. And so all of my technicians, actually, they wear rank on their shoulders to show which level they are at. And if they have chevrons, just like in the military, to show that they are either a technician assistant, a secondary, a primary, or a lead technician. And incorporating things that within my hospital benchmarks that they could achieve, and allowing them to have goals leads to a camaraderie, leads to a spirit of wanting to be there. I remember individuals that had passed their VT&E and got their licensed veterinary technician to be promoted, coming up to me and telling me they were more proud about throwing on the rank that showed that they're a licensed vet tech than actually getting the LVT of the self. So incorporating that into your culture of a career progression, I think is very important. And that's what I saw that I could take away from the military, because the military is a performance-based institution. You do better physically with your physical fitness, you're rewarded. You do better with your aptitude and your knowledge of your current job, you're promoted. And so that is also something that I wanted to do, is recognize those high performers. It's not necessarily always focusing on the negative reinforcement, but what is also the positive reinforcement that we can do. During our staff meetings, I would take time to recognize individuals that were high performers. Just like the military, they have these coins that you can give, called a commander's coin, which is a way to recognize performance rather than giving an award. The exact same thing I would do. I'd print out, a certificate of achievement, recognize them for their performance, sign it, give them a coin in front of everybody, but take that time to recognize those individuals that are high performers in front of their team, and creating an atmosphere and a culture where people can progress, I think is really important. I believe that that has reduced the turnover rate. We look nationally, veterinary technicians, the turnover rate in the hospital is about 3 years. And so how do you retain those high-performing individuals, and how do you create a view of being a veterinary technician as a career opportunity? They want a progression. They want something that they can move up to. What is the next big thing that they can achieve? And so that was a focus of mine in building this hospital, is creating opportunities for technicians to improve their technique, their talents, their skill set, having a blood donor program, making sure that the technicians were trained up for that. There's a lot of things that I could go into that I did within the hospital to give opportunities for technicians to improve their skill set and view being a technician as a career rather than just a temporary job.
Yeah, that's totally awesome. And it's so interesting because after you have a few of these conversations, themes start to emerge, like this idea of lifelong learning and having motivation and not just being a job is something that we've heard on this show over and over again. Shawn, how do you make a decision? Obviously, you've got the veterinary medicine degree, you've done that work for a long time. But after such a long career, how did you decide, hey, I want to go start my own business? I mean, that's also a bit of a departure after a military career. How did you get to that decision, and when did you know it was the right decision, and how long did it take for you to kind of realize that you didn't make a mistake?
Yeah, so very interesting. In the military, I was actually in Afghanistan. Just got done with a mission when you're downrange, you're a ranger with the Ranger Regiment, and so that's the first job. And we actually came off target and was walking back and still dusty and dirty and body armor on, carrying my weapon. Look at the computer lab where they've got computers that you can call home, and went to sit down to just check my email and saw a little LinkedIn posting from Alaska that, hey, we noticed that you're from this area. Were you interested in getting out? And at this time, I've got a newborn baby, and I'm like, I spent about 2 years in Afghanistan. I think it's about time that I get out. And replied to this basically a job posting and asking me to check it out. And I said, you know what? Let's make a push back up to Alaska and see. Well, this was a privately owned hospital. And as I went through the process of exiting the military, and my wife is also a veterinarian, we both took this position at this privately owned hospital, and then found out after we signed that he had sold to corporate. And we were really kind of upset by this. This was not something we wanted to do, was to go work for a corporate entity. And sure enough, right when we got into it, the culture of the corporate setting and seeing that everything from negative accrual to these base pay and production and how much we were producing for this hospital, let alone them not reinvesting into better equipment that we could offer better services, but also not willing to, not paying for what you're producing, bottom line. And I knew I could do better. I saw all these complaints from these veterinary technicians that were just upset about not being able to get basic equipment, not being able to practice gold standard medicine, feeling like they're letting the patients down, and seeing that, man, I could do better. And so I wanted to make something that offered a gold standard and had a mission to constantly reinvest in the hospital, pay doctors and technicians what they're worth and what they're creating and producing for the hospital. And that was my focus. And it turned, it was a big field of dreams thing. If they build it, they will come. I invested in the best equipment. I invested in a hospital that was an all-in-one, which was really lacking within Alaska. A lot of general practitioners, but very, very few all-in-one hospital where you could come in for a general practice, you could come in for emergency, you had specialists there, you had 24-hour hospitalization, you had advanced imaging, everything in one. Very similar to what you would see at like a veterinary teaching hospital. And so that was my goal, was to create a high-end gold standard hospital where the doctors and the technicians had the equipment to be able to perform gold standard medicine, and that's what we wanted to offer the clients the best options possible, and then go from there. And so there was a market for that. There's people that want that for their pets. And that's where a lot of our success. We went from starting out with 2 doctors and I think 12 employees for the client service representatives to the technicians, to now 4 years later, over 70 employees. And so that's been my progression. We've got a 25,000 square foot hospital with 5 surgery suites, 22 exam rooms, everything from 2 x-ray rooms, 5 ultrasound machines, 2 endoscopy trees, CT, MRI. Everything, invested in everything to be able to offer that and give my technicians the ability to learn new things, to broaden their career. Learn how to run a CT machine, learn how to run an MRI, to be able to have that on their resume. But obviously try to keep them long term.
That's awesome. We're almost out of time, but I want to ask you one thing before we ask our usual 2 questions. What is the most frustrating thing to you that you can name that is different between the military and the civilian management?
I think counseling and conflict resolution is probably the most difficult thing, and what I see more and more on the veterinary side is it's really kind of looked at as a not really career. You see a lot more people want to do locum. You see a lot more people want to do relief instead of setting down and wanting to stay in one area and develop a reputation, develop a relationship with the community. And so, with the military, a lot of the people that were there wanted to be there and were in it for the long haul. And so I think that's one of the most difficult things is seeing that there's less interest in a long-term commitment in an area, higher turnover rate, in dealing with the performance counselings, and I think a motivation to be the best that you can be at your job. And I don't know if it's a cultural thing or if it's changing over time, but that's when I have staff meetings, that's the one thing that I constantly harp on is regardless of what your job is, be that subject matter expert. If you're that veterinary technician assistant or you're that kennel assistant that's just starting out, be the best that you can absolutely be at that job. Be that subject matter expert and then move up to the next rank and take that on. And so really reinforcing that work ethic and that being that expert that people are going to look to you for answers because they know that you're trying to be the best at whatever your job is. So that's I think one thing that I've taken from the military and tried to apply in my leadership within my hospital is focusing on individuals that want to be high performers, rewarding that, looking at the culture and paying a lot of attention to the culture and investing in team leading, team building opportunities. To simple things. I mean, there's a lot of motivation in just getting a meal for everybody, a catered meal. How much that improves morale. There's small things that you can do that really impact the culture within your hospital.
Shawn, it was a pleasure to have you on the show. I think the approach that you're taking to veterinary medicine in your hospital are exactly what the profession needs. So really applaud you, and it was wonderful to have you on the show. We've got a couple of questions just to wrap up here. One is a book, a YouTube video, a TED Talk, something that's helped you along your career path.
I honestly, I avoided social media for a very long time, and unfortunately was forced into it, opening up a hospital, realizing how much social media played in advertising and promoting what you're doing. But so I honestly cannot say that there's a particular social media or something out there that has helped me. I've watched a few podcasts. I really enjoy some of the things that I hear from Jordan Peterson and just the way that he views improving yourself and taking the small things that make a big difference in your life. And so, that's one thing that I know that there's some political stuff that has made him kind of a lightning rod, but when you go down to the basics of what his message is, it's very, very simple. And these small steps that you can do to improve your life and your overall well-being. And so that's one social media side that I think has been interesting. And whether or not it's helped me, I don't know, but I definitely find it interesting, some of the stuff coming from Jordan Peterson.
That's cool. That's the first time I think someone mentioned him. I read his book and enjoy some of his stuff. Yeah, thank you for that recommendation. And is there someone in your network that you think would be interesting guest to invite to this show as well?
Oh man, it's interesting. I think that one of my successes has been, obviously, when you look at reps from different companies, obviously they're selling a product, right? But there's some that really, really do care about the success of your hospital and take time to invest in it. And there's a representative from Peterson. His name is Mark Johnson, who is just a phenomenal individual and a person that really was there at every step of the turn that I needed with equipment and getting the hospital going. And so that's someone that I would love to give a shout out to. And I think the amount of hospitals and doctors that he's interacted with in his career would be someone that would be phenomenal for people to hear talk, because he has represented hundreds of veterinarians in getting them started up, seeing their hospitals go from day one to 20 years later when they decided to sell. And so those veterinary reps that work for companies, they see a lot of stuff that may give a different perspective than just the veterinarian or the veterinary technician.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.